you. Thank you, Chairman Corbin and committee members for holding this very important hearing. Can you hear me okay?
Yes. Dr. Hilty, thank you. I did have one question. Would
Sure.
you prefer we save our questions to the end, or can we ask as you go?
I would, whatever you're comfortable with.
Okay.
I'm adaptable.
Thank you so much.
Thank you for holding this hearing on this extremely important topic that has had far-reaching impact on our state. I think as a provider for over 20 years, identifying a problem so you can fix it is extremely important. So thank you very much. So just in our short time here today, I'm going to just again, identify causes for loss of public trust in DHEC, identify the deleterious impacts from DHEC guidance on our state. I did have serious concerns in 2021 about data collection and also K through 12 guidance. So I did reach out to DHEC and have a dialogue with them about what their data criteria was for hospitalizations and deaths. I also submitted 4 FOIA responses. I alerted a DHEC board member to my concerns, which he shared. So he did reach out to Director Zimmer, and we've had 2 meetings to discuss exactly how these policy determinations were made and what corrective actions would be happening. I appreciate those conversations. However, I did submit a document to him with questions that I think would be helpful if they did respond in writing, explaining how these determinations were made and corrective actions that would provide a lot of transparency to the legislature as well as South Carolinians, which could help build back public trust and we could understand exactly why things went the way they did. And then most importantly, I'm going to give suggestions on how to rebuild trust and improve public health in South Carolina. So I just want to review public health structure so people have a clear understanding. We talked about the federal health agencies. So we have HHS on a public health recommendation level. We have the CDC. The CDC does not regulate, so they're a resource for the states. We do pay federal tax dollars that fund them, but ultimately they don't really have any regulatory power. The states can choose to adopt their guidance or not. Different states have statutory requirements. I did confirm with DHEC Legal that in South Carolina, DHEC is the sole advisor for all public health guidance. So again, it's good we have a resource for public health, but we are not required to adopt any CDC guidance based on, their recommendations. So again, DHEC, like CDC, doesn't really regulate. We heard about the school vaccination requirements. They do regulate there. But for many of the COVID protocols and other guidance recommendations, they do not. So the yellow down here, you can see elected officials, schools, providers, institutions, businesses, individuals. They can craft their own policy. They can adopt DHEC policy. And then there's the media that disseminates a lot of the information that DHEC does produce. I just want to provide an example because even though DHEC doesn't have regulatory power, they have great influence. So for example, DHEC gave a K through 12 masking presentation to the DHEC board in August of 2021. They did make a recommendation to mask our school children within a very short time period. It could have been a coincidence, but shortly after that, the Charleston County School Board did mandate masks in Charleston County. This was against the legislators' wishes since they put in the proviso to remove funding from any school that mandates masks. It was difficult. The Attorney General actually issued a statement. Molly Spearman at the time, who's the school superintendent, issued a statement advising against it, but they did it anyway based on that recommendation. Also, providers disseminate this information to their patients, treatments, vaccines, masking, whatever it may be. They really depend on DHEC, and they assume that rigorous vetting of the scientific literature is happening. Businesses often, even if they don't agree with the guidance per se, they do have a legal vulnerability if they don't adopt DHEC state guidance or CDC guidance. So again, even though there isn't they can't really mandate much, they do carry heavy influence, so it's very important that They reviewed the scientific literature and prioritized South Carolinians above CDC. So in my estimation, the main loss of public trust in DHEC was that DHEC adopted and encouraged certain CDC recommendations and talking points without extensive review. These were not supported by the body of evidence, which I'll review, were not adapted as emerging scientific evidence and new information became available, were not scientifically justified to be implemented in all age groups and populations, and had detrimental impacts, which resulted in other serious public health problems in our state. So some of those detrimental impacts include learning loss and developmental delays, an exponential increase in mental health disorders and suicidal ideation, especially among the young, substantial economic loss, and a false sense of security. This isn't spoken about a lot, but people really depend, especially those at risk, to follow these recommendations that are supposed to protect them. So if they're actually not proven benefits to protect, then that gives a false sense of security and can put these people in a vulnerable situation. The Hoover Institute, which is affiliated with Stanford, did an assessment of the states. A lot of people want to know, how did South Carolina do compared to other states, because we know that pretty much the whole country suffered in different ways. The learning loss, we can see we're really behind in reading in South Carolina compared to the national average, and math we're a little bit ahead. Just returning schools to their pre-pandemic performance will not fix this. So these are expected to stay with us. This was a cohort in 2019 and a cohort in 2022, and they compared the two of 8th graders. Another finding in that assessment was 1.7% of GDP over the 21st century was lost in South Carolina, equaling about $129.5 billion. South Carolina students in the COVID cohort can expect on average a 5.1% lower lifetime earning. So that's significant, and that could be the difference between living in poverty and not living in poverty. 5% is a big number for a lot of people. So what is public health? Why are we here? Public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious disease. So like anything, if we're doing well, then we get good results. So that would equal a healthy population. Public health, we have a public health agencies, but public health is much more than vaccines and masking. Okay, so there's nutrition, sleep, loving, connected relationships, and each population can be different on what their needs are. So having a thoughtful, targeted response typically almost always gets the best results. So in reviewing the first FOIA request response, just a suggestion to the legislature, you can investigate why DHEC staff did not accurately report COVID-19 hospitalizations and death data published on the DHEC website. So I did have a correspondence about pediatric COVID data, and they were very responsive, but at the end of the day, they did not divulge the data criteria. When I did submit a FOIA request, they gave me 17 PDFs of just COVID testing. So subsequently, it's indistinguishable whether the data on the website, hospitalizations were directly caused, contributed to, or were not related at all to COVID-19, like an accident or something else for a COVID positive person. So, we all depend on accurate data. Health outcomes is extremely important when we're crafting public health policy. Transmission is important, but we're really looking at health outcomes at the end of the day, especially when we have seasonal viral illnesses. So basically, school board members, like I mentioned before with the K through 12 masking, and others depend on this accurate data, so we can all assess individual risk and risk to specific populations, again, so they can craft appropriate and proportional public health policies. So this is the DHEC published COVID-19 deaths by age. We can see age 5 through 17, which is K through 12, there were 22 deaths. And it would be really useful for school board members, if they were even aware of this data, to know exactly, were these healthy children enrolled in school? Did they have serious illness or comorbidities? Or, were there some who died in accidents, et cetera? Okay, so to build back trust, obviously collect and report accurate data. Inaccurate data collection and reporting is unacceptable and has far-reaching impacts on our state. DHEC staff, I don't know if the legislator can do this, needs to be accountable.
Dr. Hilty.
Yes.
Could you go back to that former slide?
Sure.
Okay, so that's this is the DHEC published COVID-19 deaths by age.
Yes, and this has been removed from the website just because they're not tracking it anymore, publicly anyway. And hospitalizations were removed a while ago, like over a year ago, I believe.
Okay, so if you add all of those up, the 12, the 8, the 14, 251 and on down,
yes,
that'll give you a total number of South Carolinians who passed away
yes,
due to COVID. Now, is that confirmed that it was that they died from COVID and not just with COVID?
No. So based on the responses I got, and I did have 2 meetings with Director Simmer about this, so based on the FOIA responses and my conversations, it's indistinguishable whether someone died with COVID. So it could be a contributing factor, for example, if you're sick in the hospital or you have chronic illness, and that would be the thing that ultimately led to your demise. Or if someone died of COVID-19 disease, meaning a direct cause of COVID, or if it was another factor like a motorcycle accident, acute appendicitis, and they just happened to test for COVID.
Right, yeah, that's what I was curious. If you went in with an accident, a crash victim, and they passed away, but then tested and had COVID, so they didn't pair that out. Right?
So I also wanted to mention, I will provide all the correspondence that I've had with DHEC related to details of the data collection and the FOIA responses and the document that I'm hoping to get a written response from. That I think would help everybody and just provide some transparency. So you'll be able to read through that. And then
if you'll submit those to us, if DHEC won't answer you, I believe they'll be wise enough to answer us.
Great, thank you.
Send that to us and we'll get you some answers.
Thank you so much. So if DHEC staff can be accountable to provide transparency by posting on the DHEC website data criteria guidance documents on how data is collected and reported. Also, this just goes with my whole presentation, citing known knowledge gaps, sound scientific citations that support and justify all current and future public health recommendations, I think is extremely important. Often, I go down rabbit holes. I'm the one who clicks on the citations. When you click on a citation, when you read something, it should support the statement or the policy that they're issuing. And that just goes with anything, not just the DHEC website. So that would build back trust, and it would absolutely provide transparency. And we see many CDC links on the DHEC website. And then when you click on those, there's not a lot of citations there either. So that's not really again, DHEC is charged with being the sole advisor for public health, not the CDC. Okay, so the second FOIA response that could use investigating is why DHEC staff were unable to provide scientific evidence, including the risk-benefit analysis, for their recommendation of universal pediatric COVID-19 vaccination for age 6 months and up. DHEC staff, the DHEC FOIA response was, I don't know of any written risk versus benefit analysis developed by DHEC, and I can't even recall all of the data and studies and articles I read on the vaccines, their development, their trials, in children, et cetera. So parents, citizens, we just assume that DHEC is independently, rigorously reviewing this evidence and not just adopting a CDC guidance. When we do risk-benefit analysis, this is from the European Journal of Epidemiology, published about a year ago, or a little over a year ago. It's well-curated global data. That is an infection death rate. So we can see for school-age children, for example, the infection death rate is 0.0027. So when people say statistically zero, that's what they're talking about. So that would be taken into account when you're recommending pediatric vaccination, for example. I just wanted to mention, there is a debate in public health, an ethical debate, whether implementing policies that carry risk of harm in low-risk populations like children to protect the vulnerable is ethical or not. So sometimes when you hear this argument about pediatric, they say, well, it's to prevent transmission, but we know that didn't really play out the way we wanted it to. So that's the debate. So agreeing on facts and then having that ethical debate could be a useful conversation. So this is from the British Medical Journal, published in October 2020. So this is before the vaccine rollout. So Moderna, Pfizer, it's hard to see, I know. So basically, I think this was mentioned, the primary mortality, hospitalization, and viral transmission were not evaluated as primary endpoints in the study. So we just didn't know. Yet DHEC staff stated in a media article that I have the utmost confidence in safety and effectiveness of COVID-19 vaccines when obviously efficacy was not known in the real world, viral transmission was not tested, and of course we did not have safety data because it hadn't been released to the public yet. So yeah, so messaging should always be consistent with the body of evidence and what we know and what we don't know. This was an infographic taken from the DHEC website that was put up in December 16th to January 2022, showing vaccination status of cases, hospitalizations, and deaths. So we can see that about a little over 50% of those hospitalized were vaccinated. About 36% of the deaths were vaccinated. Again, the data is kind of messy, so we don't really know what this means, but the messaging that vaccines will save you, if you're vulnerable, and reduce hospitalization and death needs to be supported by current data. So making sure that we're collecting and reporting on that, and that is actually the truth, so people can make those complex vaccine decisions for themselves would be really important. So to build back trust, is obviously a thorough scientific review of the vaccine is urgently needed. We all depend on that, and some people can do it themselves. Like, I feel like I have a good handle on it, but the public in general may not have the educational background or to know even where to look or have the right questions. So we do depend on these public health agencies, even though technically, legally, they don't have direct reach over our lives, but they have a lot of influence. Pass legislation requiring a legislative oversight when adding vaccinations to the school schedule. Clearly, looking at public health necessity, things like that, is this needed? Reviewing safety, especially after this, we absolutely need oversight. And commence an employment review of appropriate DHEC staff to determine if minimum job requirements are being met. The third FOIA is why DHEC staff did not inquire about the nearly 9,000 COVID-19 vaccine adverse events South Carolinians reported to VAERS. Does everyone know what VAERS is? The federal database. It's a passive database. I don't know if that was covered before. So the DHEC staff FOIA response is stated that DHEC does not follow up or investigate VAERS submissions. In fact, CDC doesn't provide us with the information on or communicate with us about entries related to South Carolina, and they or the FDA do all the investigating and analysis on these reports. So if we look at the number of VAERS reports in South Carolina historically, these are all the VAERS reports collectively, all the vaccines. From 2012, we can see an enormous uptick in reported events in 2021. Clearly, if we're recommending something, we want to make sure if there's an unintended negative consequence happening, especially when we know historically there is potential negative consequences with vaccinations and all medications. So 90, I printed it off for the chairman, and I will send you the link for this. 90 reported deaths have occurred. It does have a description. I also want to note this is public. So this took me a couple minutes to generate this report, and I can also generate a report and send you the 9,000 so you can read exactly the circumstances of these adverse events.
Dr. Hilty.
Yes.
If you would, and this question has come to my mind a lot, and I've been asked, how hard is it to go online and navigate the VAERS system?
So the VAERS system, that's called the Wonder database, that is very difficult to navigate. However, there's MedAlerts database, so a data scientist basically captures the Wonder database information, and he created a much more easily navigatable system.
And that's called what now?
It's called MedAlerts, and it's on the National Vaccine Information Center's website.
That's not the one that everybody typically thinks of. Everybody kind of thinks of the VAERS system.
Exactly, yes.
And so is that if you're vaccine injured, is that easy to go on and go into the system and report it, or is it a bit arduous to do
So the reporting itself is difficult. Also, many people, even though when you get by the 1986 Act, you're supposed to get what's called a VIS that has that VAERS information on how to report. Anyone can report. It's passive. That's why the data isn't the best, because we don't know. Just because you report doesn't mean it was caused. It's for the government to curate and do a data analysis and see if there's any safety signals. But most people, aren't aware. HHS did a study, and less than 1% of vaccine adverse events are reported to VAERS. And then providers and the public have complained, for lack of a better statement, that it's very difficult. It also times out. So you have to put in all these fields, and then if it times out, you have to start over again.
And that was my point, because I've been approached by a lot of people who, well, I'll give you an example. A friend of mine was vaccinated and had some ringing in the ear. Another friend of mine was vaccinated, had some ringing in there, lost their hearing. Now have to have a hearing aid. I don't think that was ever reported to VAERS. I don't think that was, and I would agree that what'd you say, 1 in 100 adverse events perhaps are reported, or 1 in 10?
So based on one HH study, a Harvard Pilgrim study, it's less than 1%. And then there was another, I believe, CDC study that it was between like 1 and 10%. So very low rate.
Right. So if the scientists can, proclaim that the vaccine is safe and effective, we can also proclaim that the VAERS is woefully underreported. Right.
Yes. Okay. And I will say, so my next point here is I have contacts at the CDC's Immunization Safety Office, they're the ones who run the VAERS database. If you call them up, they will agree that they know that vaccine adverse events are underreported. With the senior scientists there, this is not controversial at all. And when I did talk to them about South Carolina, and if they're communicating with the states on vaccine adverse events, they did say that they do communicate with South Carolina designated vaccine safety coordinators. They should be receiving weekly reports on specific South Carolinian COVID-19 adverse events from VAERS. So I don't know. DHEC might not be in the loop on that. I'm not sure what's going on, but the people making those recommendations should absolutely be monitoring those adverse events. Whether they need to investigate them, that's a whole nother story, but they should be aware of that. Of course, South Carolinians depend on it and expect DHEC to closely monitor the safety of COVID vaccines. I think most South Carolinians would feel very upset that this isn't being monitored. So to add complexity to this, based on DHEC's safe and effective messaging, many South Carolinians have been required to accept COVID-19 vaccines as a condition of their employer or educational institution. Also, DHEC staff who recommend universal COVID vaccination cannot be held legally or personally accountable because of the 1986 Act and the EUA at one time. I agree, passing legislation that protects South Carolinians from being mandated indemnified products that carry risk of harm. Again, we have no idea if this will ever get fixed, but protecting citizens. I've been a provider for years, mostly in New York City. I've worked in almost nearly every population you can dream of. I can tell you for sure, the overwhelming majority of people can make intelligent healthcare decisions for themselves. They don't need to be mandated anything. The final FOIA response that I believe needs to be investigated is why DHEC staff have not provided adequate scientific evidence, including a risk-benefit analysis, to support the recommendation of universal masking in schools. Based on the FOIA response, DHEC staff reported the recommendations DHEC provided were based off CDC guidance. They did submit that DHEC board presentation that I spoke about in the beginning on K through 12 masking, and they did rely mainly on observational studies and models for efficacy, which are not reliable. They did do a review of safety of masking, and in the absence of evidence, concerns that universal masking in schools may have unintended harmful impacts on children were rejected. So this is a slide from their presentation. Basically, they state that no data on impact of mask wearing on academics were identified during a thorough review of the scientific literature. This kind of echoes what Mr. Siri was saying. So in the absence of evidence, it's not in the best interest of South Carolinians to presume safety. That's a big no-no, and if people knew that, then I think the messaging isn't consistent with the body of evidence.
And Dr. Hilty, you showed a slide back or two of the children in school wearing the little surgical masks. Those were the ones that were handed out by the hundreds of thousands as you went into grocery stores or whatever. There's been studies done on the efficacy of that type mask. You know, N95 works better than this, and people were wearing cloth masks, different sort of face coverings. Do you know off the top of your head what the efficacy is of the typical surgeon mask or the cloth mask? I mean,
so based on that, I'm going to cover that in a little bit, but based on the body of evidence, and I spoke to the director about this in both meetings, based on the body of evidence, using the highest quality of evidence, the body of evidence suggests that masks do not support a public health benefit and viral transmission and protecting people from viruses.
and I saw a study on that some time back, and I forget the numbers. It was some months back about how effective the N95, which evidently is the best, if it's properly fitted, can give you some protection. And basically, the surgical mask that everybody was wearing around was virtually no protection.
Yes. So viral aerosols are microscopic, so they're tiny. Respiratory droplets are a little bit bigger, so if you sneeze and you cover your mouth, some of those respiratory droplets, some of them, not all of them, will be trapped. But viral aerosols are tiny, and a cloth mask is not capable of stopping them. Plus, you have the air underneath. Typically, if there is, in hospitals, they have specialists that fit providers with masks. And typically, you only wear them for about a half hour. And they're higher quality masks, and it doesn't mean that you're 100% protected there either, but obviously they're more effective. Cloth masks in schools with children, especially, who are touching, pulling, and even if they wore them perfectly, they're just not going to offer that benefit. Yeah. That, and if they would have worked, great, but when they don't, and that's covering children's face that we know are causing learning loss and other issues, that's a problem. They also rejected concerns about masks not affecting your child's ability to focus and learn in schools. Again, they just rejected the concerns without evidence, and there was no evidence that masks cause delays in language and development of speech, again, because it was never properly studied. So they're just denying that there's a negative impact. Now, going back to your question, the quality of evidence, if we look at the bottom of the triangle, observational studies and models are at the bottom of that triangle, and an expert opinion without evidence should be off the triangle. I just put it at the bottom of the triangle. And then one of the most recent, strongest studies is the Cochrane review, which they took 78 peer-reviewed studies, and they determined what I suggested before, that cloth masks do not offer a meaningful public health benefit, and that would be at the very top of the triangle. So you're always going to have conflicting studies to a degree. Again, methodologies in the same way with data criteria are really important to look at. But when we look at a body of evidence, that's how we make determinations. DHEC is continuing to strongly encourage everyone who learns and works in a school setting to wear a well-fitted mask consistently and correctly when around others. This was still up on the DHEC website from a couple days ago. I wanted to show this. So DHEC K through 12 guidance for schools. I don't know if anyone saw this in this document. They would publish these every so often. This is the contact tracing paradigm, I guess, they used. If we look at the green germ there in the middle, that's an unmasked student who's positive, and then based on the distance a masked child or an unmasked child was away from them, between 2 and 4 feet, they were kept out of school for up to 10 days. So this resulted in learning loss, social isolation, and other issues, and I couldn't find any citations or any body of scientific evidence to support this at all. This is another one. This is a masked positive student there in the middle, and then you can see masked, unmasked, between 2 and 7 feet. So it's very illogical. Clearly, this would erode parents' public trust in DHEC when their child's being kept home from school, and it just clearly doesn't make sense to, I would say, most parents. So to build back public trust, amend Title 44-150, remove language fining or imprisoning a person for not complying with a DHEC regulation in an emergency, and other things too. And then perform a legislative assessment if South Carolina taxpayers are getting a good return on our investment in DHEC. And thank you, and I welcome any questions.
Question, yes. Senator Gary.
Thank you for being with us today. Thank you also. I got some of these documents from you from your click, and you know, I sit there and I read about 10 of those studies. It was just basic information, you know, it say the first woman was 26 years old, and female, et cetera, et cetera. But I saw no analysis anywhere. So, I mean, all that information was great. I mean, I'm glad to hear about it. There was 910 of those reported, but I saw no analysis anywhere. Are you telling me that South Carolina didn't analyze the South Carolina people that died or had problems from COVID?
So that just based on, and you can ask them this question, but based on my conversations with the FOIA response, they stated that it was CDC and FDA's responsibility to monitor and investigate.
South Carolina people?
Yeah, South Carolina.
Our citizens,
yes.
Our constituents, it's the government's, the federal government's responsibility?
Yes. So, well, that's what DHEC was stating, so basically that they were leaving it up to the federal government to investigate those injuries and deaths. Yes.
Our businesses could have been charged $1,000 a day. Our people could have been in prison for 30 days for not complying. And so all of this is being done out of the federal government, and so the state government, as far as you can see, you found nothing to show us otherwise, that anybody at DHEC even did any studies or analysis on our COVID deaths, our COVID injuries.
That's right.
Is that what you're telling me?
Based on what they communicated, that's correct.
Yes, thank you.
Yep.
Yes, Representative Davis.
Thank you. And thank you for all your work. This is really good information and really helpful for us to talk about maybe next steps for us legislatively. You did very briefly mention HR within DHEC, and I wanted to know if you had seen the recent report that was published by the South Carolina Legislative Audit Council that talks about HR within DHEC and has a number of what I would call deficiencies that that we need to go in and fix. I was just wondering if you were aware of that most recent report.
No, I have not seen that.
Okay, if you got a minute and were able to take a look at that, I would appreciate that.
Sure.
Thank you.
Thank you.
Representative Morgan.
In all of your FOIAs, did you run across any times or evidence when the CDC was pushing something and you found where DHEC said, oh, no, we're not going to do that? Or was there just no evidence of that? It just seemed to be whatever they were saying. And I'll ask DHEC this, but I'm just wondering if you ran into any evidence.
So based on, for the masking,
Anything.
they did say, they did say we adopted CDC guidance on this. And then just through my own analysis, and I did talk to the director about this in our meetings. So this document, this is a DHEC document, but much of it not all, but the majority of it was adopted from CDC guidance for K through 12 guidance. Also, the vaccine rollout was very, similar messaging to CDC. So yeah, a lot of state agencies do that. We have qualified people, with masters in public health. We do have employees that are qualified in our state who should have the ability to do this. But many states do depend on CDC, and they just, again, maybe it's the same as when a provider assumes that DHEC has rigorously vetted something, so they feel very comfortable that something's safe and effective and that they should pass on this advice to their patient. It could be the same sort of thought process with our state health agency and CDC. So that would be a good, I think, conversation to have
Yeah,
with
I mean, 'cause
DHEC.
especially after the
Yeah.
last testimony, it's like we know that they weren't doing, CDC and FDA and everybody was not doing their job, even
Yeah.
with childhood or with COVID or whatever. And so I guess my key question is, did DHEC just, first of all, are they even aware that the FDA and CDC are not doing their jobs at all? And are they just taking stuff and forcing it here, not even, checking into it? And so, like I said, I'll ask them, but I'm wondering if when you're investigating, did they say, oh, well, yeah, we know there's concerns and they have said some things, but we didn't push those? Or did they just kind of say, yeah.
Well, you can, I don't want to speak for Director Simmer, but I brought that up, and he did say that, they didn't adopt everything. So he gave me a few examples of that. So he'll be able to explain that. But that's exactly why I started doing the FOIAs, because I have a young child. This started when she was in preschool, and I couldn't really wrap my brain around some of the policy determinations and the science, and the data was a little more inconsistent with other states and global data. Yet the media, and they're just picking up what DHEC is saying is messaging people, and it was a very panic. And so that's what caused me to reach out, because it just did seem like it was kind of like a top-down approach. So.
Any other questions? Well, Dr. Hilty, thank you so much for all your research and your effort into this matter, and thank you so much for coming today.
Yep,
We
thank
appreciate
you.
it.
Thank you
Anything you want to submit, please get it to Mr. Brilliant here next to me, and he will make sure that we all have it and it's entered into the record.
Okay, great. Thank you so much.
Colleagues, we're going to need to take a 10 or 15-minute break here. I think our tech folks are needing to do a little catch-up on some things coming up. So if we could just take maybe say about a 10 or 15-minute break, and then we'll resume. Thank you.